Former talk show host Wendy Williams has been diagnosed with a form of dementia and a communication disorder called primary progressive aphasia, which is a rare disease that has a typical life expectancy of between 7 and 12 years after symptoms show. 200,000. That's about how many people in the U.S. have PPA, making it a rare disease, according to a study published in the journal F1000 Research. About 1 million Americans have aphasia, and almost 180,000 Americans are diagnosed with some form of the disorder each year, according to NIDOCD data. Because major changes in the brain happen after brain injury, many patients with aphasia see great improvements in their communication within the first few months of onset without treatment, though aphasia may remain after this initial period, according to the NIDOCD. Other forms of aphasia are caused by injuries to the brain like a stroke or head injury. There are 3 common forms of PPA, according to Harvard Medical School: logopenic, semantic and nonfluent, or agrammatic. Logopenic PPA is usually caused by Alzheimer's disease, and causes difficulties with finding words. People with this form of PPA struggle with finding everyday words, though they know what they mean. Semantic PPA is typically a result of frontotemporal lobar degeneration, and causes difficulty understanding what common words mean. Nonfluent PPA is also typically caused by frontotemporal lobar degeneration, and causes patients to know what they want to say, but struggle with getting it out, resulting in incorrect grammar and improper sentence structure. Williams's team did not specify whether she was diagnosed with a specific type of PPA. Frontotemporal dementia, or frontotemporal degeneration, is a blanket term for a group of disorders caused by the progressive loss of nerve cells in the brain's temporal or frontal lobes. This cell damage results in a change in behaviors and thinking. Symptoms of FTD include trouble communicating, difficulty working, emotional problems, difficulty walking and unusual behaviors. Because it's progressive, it gets worse over time, which may result in high levels of 24-hour care. Life expectancies with FTD range, as some people can live up to 10 or more years, while others only live for 2. FTD typically affects people between the ages of 45 and 64 years old, and accounts for fewer than 1 in 30 of all dementia cases. Wendy Williams diagnosed with frontotemporal dementia and aphasia, Forbes.